So when was the last time your cardiologist asked about your gums? Probably never. And yet, the connection between your oral health and your heart is one of the most underappreciated relationships in medicine. So what's happening in your mouth right now is influencing what's happening in your arteries. Today, I want to walk you through exactly how that works, what you can do about it, and why a little honey might actually be good for your heart. Stay with me on that. Hi, I'm Dr. Pachipala, who is a board-certified internist, hematologist, and oncologist. So let's discuss how your gums and your heart are more connected than you think. Your mouth is home to over 700 species of bacteria. When the balance shifts, usually from poor oral hygiene or a sugar-heavy diet, bacteria like Porphyromonas trigger gum inflammation. That is called periodontitis, and it doesn't stay local. So chronic gum inflammation releases inflammatory signals such as CRP, interleukin-6, TNF-alpha into your bloodstream. These are the same molecules that drive arterial plaque formation. People with periodontitis have a 20 to 30% higher cardiovascular risk, and that's not a small number. Now let's discuss about something most people do not know much about. Not all oral bacteria are the enemy. Certain strains like Veillonella, Actinomyces, Neisseria convert dietary nitrates from vegetables into nitric oxide, a molecule that relaxes blood vessels and lowers blood pressure. It's one of the key reasons a leafy green rich diet is so good for your heart. But here is the problem. Broad-spectrum antibacterial mouthwash kills this bacteria too. Studies show that people who use antibacterial mouthwash twice a day have measurably higher blood pressure because they have wiped out the bacteria responsible for that nitric oxide pathway. That's a real clinical finding, and it changes how I think about recommending mouthwash. Let's now discuss about what you can do about it. Number 1, brush and floss consistently. Twice a day brushing, once a day flossing, and regular dental visits. The goal is managing your oral microbial environment. Be thorough but gentle. Number 2, rethink your mouthwash. If you're using broad-spectrum antibacterial mouthwash twice a day, consider scaling back. Talk to your dentist about targeted options that address harmful bacteria without wiping out the beneficial ones. Closis and TheraBreath are some options that are beneficial to oral bacteria. Number 3, feed the right bacteria. High nitrate vegetables such as beets, spinach, arugula support the bacteria that produce nitric oxide. Polyphenol-rich foods such as green tea, berries, dark chocolate selectively suppress harmful bacteria. Sugar feeds the bad actors. Cutting it is one of the best things you can do for both your gums and your arteries. Number 4, consider probiotics. Lactobacillus reuteri has been shown to reduce gum inflammation markers. Yogurt, kefir, and fermented vegetables support a healthy oral microbiome. Number 5, treat gum disease. Don't ignore it. Scaling and root planning reduce systemic inflammatory markers. Treating periodontitis is not just a dental intervention, it's a cardiovascular one. So now let us discuss about honey. Raw honey, particularly Manuka and other minimally processed varieties, contains polyphenols that suppress harmful oral bacteria like Streptococcus mutans while leaving beneficial bacteria intact. That selectivity is what makes it different from chemical mouthwash. The polyphenols also act as prebiotics, feeding beneficial gut drains like bifidobacteria and lactobacilli, which reduces systemic inflammation downstream. A teaspoon of honey in a tea or stirred into yogurt gives you those benefits without meaningful sugar loading. I'm talking about raw, minimally processed honey. Quality matters. So in conclusion, your mouth is not separate from the rest of your body. The bacteria in your gums, the inflammation in your gum tissue, the nitric oxide your oral microbiome produces, all of it connects to your cardiovascular system. So brush and floss consistently. Be thoughtful about mouthwash. Eat more leafy greens and less sugar. Treat gum disease if you have it. Add raw honey, fermented foods where you can. Small adjustments, but the biology behind them is real, and the long-term impact on your heart is meaningful. Healthy gums are not just a dental issue, they are a cardiovascular one. If this video gave you a new way of thinking about your health, hit and subscribe for more practical, evidence-based content. Share this with someone who looks after their heart but has not thought much about their gums. It might be the most useful thing they watch this week. Take care of yourselves, and I will see you in the next one. Thank you.